Okay, so he's already marked, but if you're doing the prepping and you're going to be using these, exactly the same thing. So find your locations, clean with the acetone sandpaper, and then you're going to apply. Now, what you'll find out is there's a very short little strip here that comes down. That's where the person is going to take it off. It's actually easiest if you have that down rather than up or to the side. That way it's easy to pull up because they're going to take their own off. Now, stick them on the inside. Remember that the center part is where the gel actually is, and there's a snap on the other side that is what's going to be attached. So you simply put them in the same locations. And I tend to do the limb leads first and then move on to the chest leads, simply so that you're keeping everything in an order. So the first one was on the longest, so that's my best mark. And this is where you're going to place V2, which is fourth intercostal space, to the left side of the sternum. And then you're going to place V4, which is the mid-clavicular, in the fifth intercostal space. So you're going to place that one first. And you'll notice that there's not very much space in between. You go, well, these are way too big. Remember that the only thing that actually needs to be next to the skin is this little center mark, and there's plenty of room for that to happen. So then you place 3 right on top. And then we have B5 and B6. So what I've seen in classes past is they're all the way down here rather than up here. Remember that the position of the heart, you want them to be as close to the level of the heart as possible, so that when the electrical activity is reaching it, it is in some sort of alignment with the heart itself. Now we're not actually going to run it, but I'm going to bring the Okay, so this is attached to the ECG, of course. And what you'll notice is now we actually have all 10 leads. So there's no more of the having to move the chest around. And you'll notice that the colors are exactly the same. Does anybody remember what white was? Right is white, and it's the upper arm. Now, there's a little blue tab on the back. That's the latch. So you want to have that open when you first put it on. The hole on the back needs to go over the top of the snap. And then you clip it down, and you want to check and make sure that it actually is attached before you move on. Black was left arm. Green is ground, right leg. And red is left. And it's on. So now the chest leads, remember brown was the chest lead. You go, well, they're all brown. Fortunately, they also have a mark on it that's going to tell you it's a V1, that's a V4, that's a V3, that's a V5, V2, V1. So put them on in the order, obviously, of V1, V2, V3, V4, V5, and V6. Now, this one, the only thing that's important is inputting the information into it, because all you're going to do is push a button and it's going to do the whole 12-lead ECG. So there's no more of having to turn a dial or anything else. It's simply push a button. So obviously once this is all on, it's actually a much faster process than the old single channel. So if you are a cardiologist and you do a lot of these, you probably are always going to be using this. If you go into the emergency room, this is what you're going to see. You're not going to see the old style. Now, it's not that people don't still use these. They do. They can also be made with the extensions like this so that you don't have to use the suction. But like I said, the connection, because you have much larger coverage, skin coverage, it's actually a much clearer outcome than it would be if you are simply using the single spots. Okay, so that's the placement of the electrodes. Once it's on or done, you check it and make sure that it all read correctly. If it didn't, then you can run another one. But all you do is you take the electrodes back off again. Say thank you very much. Go ahead and pull them all off yourself. So this is torture class. All right. Any questions?
Do you need to memorize?